Casa de la Familia specializes in trauma. We are there to provide the mental health services to the underserved and unrepresented community. Hello, I'm Dr. Ana Nogales. I found Casa de la Familia about 30 years ago, but it actually started when I was a child. I was about 8 years old when I heard in town there were kids that didn't have parents, that didn't have a home. So in my mind, I said, someday when I grow up, I'm going to have an orphanage for those kids. I went to the university and I studied psychology, which I loved. Then I came to the United States in 1979, working with an outpatient community center with people with addictions and people that were on probation. I was invited to different radio stations. There was nothing about mental health in the Spanish radio. We were talking about issues of mental health, always about mental health. I was in media so much, I learned a lot from the community, from the needs of the community. And that's how I created Casa de la Familia. It wasn't an orphanage. Casa de la Familia was a home for those that needed to talk to someone about their most intimate, dark thoughts, feelings, emotions, someone that they could trust. Casa de la Familia provides many services. We do individual therapy, family therapy, we work with children, adults, elderly, and we also have groups that provide support for victims of domestic violence, victims of sexual assault.
The Domestic Abuse Response Team is a program that pairs an advocate with an LAPD officer to respond to domestic violence calls. The advocate is able to support the survivors navigating after leaving an abusive relationship, such as following through a restraining order, going through the justice system, and finding shelter if that's what they need.
At Casa de la Familia, we provide services specific to trauma-related care, but also very specific to our community, to the Latino community. We are very family-oriented. Communicating in your own language is so important, not translating.
The story that I could remember that have stayed with me for a really long time is of a young woman who was trafficked from Central America to Mexico. Casa de la Familia stepped in and provided her with the mental health services that she needed. She stayed with us for about a year, and thereafter we could see the transformation and how mental health services really saved her life. They are smiling, they're happy, and they're full of hope. I have been with Casa de la Familia for over 13 years, and one of the reasons that I continue to stay is because I know that our work creates and makes an impact in our community. And Casa de la Familia is their familia, and we care for them deeply. We follow up with our clients through advocacy services, through outreach services, and of course through mental health services.
Our hope is to develop more and more programs. We have programs about domestic violence, about sexual assault, human trafficking, but there's so much to do in the community, so much. If Casa de la Familia would not exist, it will be a significant loss, because people, the community, will lose the opportunity to come to us because they trust us. They have the confianza to talk to us about their own issues.
We're currently servicing over 5,000 clients, and these services have doubled since the pandemic. Unfortunately, these needs continue to increase. This is why we need your support.
We need financial contribution, because without finances, there's no way that we can do these programs. My vision is no longer mine. It's our vision. We all share the same vision. It's the community vision. Here we are.